So today we will study 5 of the bones in the cerebral part of the skull. We will study frontal bone, parietal, occipital, sphenoid, and ethmoid. Yeah, all cerebral skull bones except the temporal one. So what do we have here? First, the frontal bone. Yeah, its anatomical position, I hope you know. Yeah, frontal bone consists of 3 parts, 3 main parts. There will be squamous part, orbital part, and nasal part. On the anterior part of the frontal bone, here we have the frontal eminence or frontal tuberosity. Here, 1 and 2. Yeah. In some individuals, 2 halves of the frontal bone they develop separately, and they form the frontal suture in the middle, or it can be also called the metopic suture, like in this skull.
Metopic suture.
Yes. What's next? Inferiorly, we have the supraorbital margin, which is the border between the squamous part and the orbital part. Above the supraorbital margin, we will see superciliary arches, superciliary arch 1 and 2, which forms the shape of our eyebrows. Laterally, these parts they continue as a zygomatic process, which articulates, which connects with the zygomatic bone here. Lateral surface of the frontal bone forms the anterior part of the temporal fossa, and here the margin will be the temporal line and the temporal surface on this lateral side. Here, temporal line and temporal surface. In the middle, above the nose, there will be the region which is called glabella.
Glabella.
On the supraorbital margin, we will have the supraorbital notch. Here it is better visible, supraorbital notch. In some individuals, it can be supraorbital foramen. So if it is closed, yes, it will be the foramen. In some individuals, it is here. Yes.
What?
It is needed for passage of supraorbital artery and supraorbital nerve. Then, on the orbital surface of the frontal bone, we will have the fossa for the lacrimal gland. Here, our lacrimal glands are located. Medially, we will find the trochlear fossa and the trochlear spine, which are needed for attachment of the trochlea of the superior oblique muscle. In the nasal part, the structure which is visible, it is the nasal spine. Here, nasal spine, and between 2 orbital parts, there will be the notch, which is called the ethmoid notch. Ethmoid notch, because the ethmoid bone is inserted in here. Like this, yeah? The ethmoid bone is inserted. On the internal surface of the frontal bone, we can find different structures. There will be some structures which are present in many cerebral skull bones, like arterial grooves here, yes. Digitate impressions, which are left from the gyri of the brain, and cerebral eminences, which are left from the sulci. In the middle, we will find the frontal crest, and superiorly it will continue as a groove for the superior sagittal sinus. Superior sagittal sinus, it is the dural sinus, sinus of dura mater. What is the dural sinus? Dural sinus, it is the cavity formed between the 2 layers of the dura mater. We have numerous sinuses inside of the skull, and they serve us as veins. for venous drainage from the brain. The largest of them is called the superior sagittal sinus. It is called so because it is located in the sagittal plane, beginning from the frontal bone here, continues on the parietal bones, and it terminates on the posterior surface of the occipital bone here. Any questions about the frontal bone? No. Now let's talk about the parietal bone. Parietal bone, you see, it has 4 angles and 4 margins. You have to determine which bone you're holding, right or left, and find out each angle and each margin on the separate bone. So on this bone, this is left one, yeah? Here. It has 4 angles. Anterior superior angle is called the frontal angle. The frontal angle is directed to the frontal bones. Posteriorly, there will be the occipital angle, which is close to the occipital bone. Under the frontal angle, we will find the sphenoid angle, which articulates with the sphenoid bone, and here, the last one will be the mastoid angle, which is close to the mastoid process of the temporal bone. And how to determine each angle. So, first, you may look at this angle. This is frontal angle, and you see that it is the closest to the 90-degree angle. Yeah? Other angles, they are less they have not so direct shape. Okay. Near the occipital angle, we have one more structure which is called parietal foramen. Here, parietal foramen. It is needed for passage of the emissary vein. Emissary veins, they are veins which perforate the skull bones to connect the intracranial veins with the extracranial veins. Margins. So, anterior margin of the parietal bone. Anterior margin of the parietal bone is called the frontal margin or frontal border of the parietal bone. It directly connects with the frontal bone and forms the coronary suture.
Okay.
Yeah, with the frontal bone. Posterior border will be the occipital border, which can articulates with the occipital bones and form the lambdoid suture. Here we will find the sagittal border. Sagittal border connects with the second parietal bone and forms the sagittal suture.
Okay.
And inferiorly, we will have the squamous border. You can see that squamous border is the thinnest one, and it has more rounded shape, and it articulates with the temporal bone and forms the squamous suture. Above the squamous border, we will find 2 temporal lines, inferior temporal line and superior temporal line, which are also the borders of the temporal fossa and place of origin of the temporalis muscle. Yes, it is one of the muscles of mastication. On the internal surface, we can see numerous arterial grooves, digital impressions, so on. Here on the sagittal border, we will find the groove for superior sagittal sinus. And near the mastoid angle, we will find the groove for the sigmoid sinus.
Okay.
And one more dural sinus, sigmoid sinus. Okay, occipital bone here is lavender colored bone on this skull. It has 3 main parts. What are these 3 parts? The most anterior one is called the basilar part, because it forms the base of skull here internal. Then it has 2 lateral parts, and squamous part. Between all this part, we will find this large foramen, which is called foramen magnum. Yeah, and I have a question for you. Let's imagine the situation that you suddenly have swallowed the 5 ruble moment. Five ruble coin.
Okay.
Will it pass through this foramen or not?
Yes.
If you will swallow 5 ruble coin, will it pass through this foramen magnum or not?
No.
अरे वो फोरामेन नहीं, स्पाइनल कॉर्ड है, ये यहाँ से जाता है, ये यहाँ से जाता है.
Explain them please why it won't pass through this foramen.
स्पाइनल कॉर्ड का है, स्पाइनल कॉर्ड.
Explain them.
तोड़ना नहीं है भाई को.
This is because this foramen is for spinal cord, not
Not for easy.
digestive tract.
Spinal.
Let's start with the external surface.
Yes.
On the basilar part here, we will find the pharyngeal tubercle, place of origin of the pharynx. Yeah, here the pharynx is attached. Then we will look at the lateral parts. Here we will find the occipital condyles. So pairs of occipital condyles, they are needed for articulation with the atlas and forming the atlanto-occipital joint.
Okay.
Laterally to the condyles, we will find 2 jugular notches. Jugular notches, they when we combine the occipital bone with the temporal bone, we have the jugular foramen here.
Jugular foramen and jugular notch.
So jugular notch, it is the part of the jugular foramen. Then here you have the jugular foramen in the picture. Then, under the condyle, we will find 2 canals. Here it will be the canal of the hypoglossal nerve, 12th pair of cranial nerves. Yeah? And here we will find the condylar canal.
Okay.
Condylar canal near to the condyles needed for passage of the emissary vein. From here.
What vein?
Emissary vein.
Emissary
Condylar emissary vein.
Okay.
Further, in the center of the squamous part, we will find external occipital protuberance. You can easily palpate it on your external occipital protuberance.
Yeah, got it.
Occipital protuberance.
Yes. Found it? Yes.
Nucleus.
Inferiorly to this protuberance, we will find external occipital crest.
Okay.
And there will be 3 nuchal lines which cross this bone transversely. Inferior nuchal line, superior nuchal line, and the supreme nuchal line.
Okay.
Questions?
No, sir.
What is it for?
For insertion of muscles.
Okay.
Different humerus muscles. If you were studying the muscles of back, you should answer me this question. Spinalis, for example. Splenius, capitis muscle.
Yeah.
On the internal surface, in the middle of the squamous part, we will find the cruciform eminence.
Okay. Crucial eminence.
Cruciform or cruciate eminence. In the middle of it, we will find the internal occipital protuberance.
Okay.
Inferiorly to this, we will find the internal occipital crest. Superiorly, the groove for superior sagittal sinus will be present, and laterally, grooves for the transverse sinuses. Closer to the basilar part, we will find the groove for the sigmoid sinus, groove for the inferior petrosal sinus, and between 2 grooves of the inferior petrosal sinus, we will find the clevus. Clevus, yes. The part here, this part is directed to the sphenoid bone, and here we have our brainstem line on this part.
Okay.
Brainstem.
Brainstem line.
Yes, pons and medulla. It consists of several parts. It consists of 2 pairs of wings. There will be greater wing,
Equatorial wing.
greater
Greater wing. Okay.
yes, then lesser wing we
Okay.
have.
Listen.
In the middle there will be the body,
Okay.
and inferiorly we will find the pterygoid process. pterygoid process.
Okay.
In the middle of the body, there will be the part which is called the sella turcica. Yes, sella turcica, or so it will be like a Turkish seed translated. Anteriorly, it has the tuberculum cella. Posteriorly, it has dorsum cella, and in the middle there will be the hypophyseal fossa. Yes, or the pituitary fossa for the pituitary gland.
Okay.
So it is located in here. Greater wings of the sphenoid bone, they have 4 surfaces. Posterior, this surface is called the cerebral surface because here the temporal lobes of the brain lie. Anteriorly, there will be the orbital surface because they form the lateral wall of the orbit. Here, external surface is called the temporal surface because it is part of the temporal fossa. And inferiorly, there will be maxillary surface because it is directed to the maxilla. In the lesser wings, we will find the 2 optic canals. They are needed for passage of the second pair of cranial nerves, which is the optic nerve. Between these 2 optic canals, we will find chiasmatic groove, where optic chiasma lies. Yeah, it is like a crossing and connections of 2 optic nerves. So, between the lesser and greater wings, we will find the superior orbital fissure.
Superior orbital fissure.
Superior orbital fissure. It is needed for passage of the 3rd, 4th, first branch of the 5th and 6th cranial nerves.
Okay.
These 4 cranial nerves will pass there, and also ophthalmic nerves will pass there. Further, we will find the foramen rotundum. Rotundum. Yes, foramen rotundum. It is needed for passage of the 2nd branch of the trigeminal nerve.
Okay.
Yeah, it is called maxillary nerve. Next, we will find the foramen ovale.
What?
Foramen ovale.
Foramen ovale. Here and here.
Okay, yeah, this is.
It is needed for passage of the 3rd branch of the trigeminal nerve, which is called mandibular nerve. So trigeminal nerve has three branches. Ophthalmic passes through the superior orbital fissure, maxillary through the foramen rotundum, mandibular passes through the foramen ovale. And the last foramen in the great wing is the spinosum, foramen spinosum. It is needed for the passage of the medial meningeal artery, yes, which supply the dura mater and the arachnoid, and meningeal branch of the mandibular nerve. Anteriorly on the body, we will find the concha.
What's it?
Concha.
Concha.
Yes. C-O-N-C-H-E.
That's what I.
And here we have the aperture of the sphenoid sinus.
Yeah.
Aperture of the sphenoid sinus. What is sphenoid sinus? We have, in addition to the dural sinuses, we have also paranasal sinuses. In our skull, paranasal sinuses are cavities inside of the bones, inside of the skull bones, which are connected with the nasal cavity. They filled with air. Yeah, not with the blood like dural sinus. They are filled with air. And we have these sinuses, these cavities in 4 skull bones. In the frontal bone, there will be frontal sinuses, like here. In sphenoid bone, we have sphenoid sinuses. In the maxilla, we have the maxillary sinuses. Have you seen any of the acoustic musical instruments? Guitar, acoustic drums, and so on. What is their feature? They have hollow cavity, yes, to make the walls of this cavity resonate and make the sound louder, richer, and so on. The same happens with our voice, for example, yes. So we have these cavities inside of our skull bones, which are resonating when we are talking, and
They're connected with our nose.
yes, they are connected with our nose.
Okay.
So voice modulation is connected with them.
When you have let's try to remember last one. And here we have the aperture of the sphenoid sinus, the entrance to the sphenoid sinus.
Okay.
In the middle we will have the sphenoidal crest and sphenoid rostrum.
Crest and
Rostrum,
rostrum.
yeah. Inferior part of the sphenoid bone is formed by the pterygoid process. Pterygoid process consists of the medial plate and lateral plate. Between these two plates we will find the pterygoid notch.
Very, very long.
Yes. Above the pterygoid process we will find the pterygoid canal.
Okay.
Pterygoid canal.
Very good. Canal.
And on the dorsal surface of the pterygoid process we will find two fossa. There will be the pterygoid fossa here and the scaphoid fossa.
Pterygoid fossa and scaphoid fossa. Okay.
Pterygoid canal here.
There are so many structures.
And then
Every
this
bone.
pterygoid canal. There are
This is pterygoid canal.
We should remember every
there are
name, sir.
three canals.
Yeah, bro.
No, here
Tell me.
canals, only two canals, optic canal and pterygoid canal.
Tell me now, bro.
But it has also superior orbital fissure and three foramen like foramen rotundum, foramen ovale, foramen spinosum.
Oh my God, so many foramen.
Yes. It's
And-
very confusing.
And you also have to know what passes through each foramen.
Oh my God, I'm getting lightheaded.
Yes. And also I forgot to tell you about the carotid groove. Here we have the carotid groove where the internal carotid artery passes. Ethmoid bone has a really interesting position because it forms the part of the cerebral cavity, yeah, the anterior cranial fossa here.
Okay.
Also, it forms the medial wall of the orbit, and it forms the lateral wall of the nasal cavity, superior wall of the nasal cavity, and the part of the nasal septum. So, superior part of the ethmoid bone presents as the cribriform plate. Cribriform plate. Cribriform plate with the foramina in it. Yeah, cribriform foramina. These foramina are needed for passage of the fibers of the ophthalmic olfactory nerve. Olfactory nerve. Yeah, first pair of cranial nerves. Superiorly, there will be the structure which is called crista galli.
Crista Galli.
Yes, crista galli.
Galli,
G-A-L-I. Laterally, we have two plates, which are called the orbital plates. Orbital plates, they form the medial wall of the orbit.
Okay.
Between these plates, we have the air-filled cavities, which are called ethmoid cells. Yeah, cells. Yes. These cells, they can be anterior, medial, and posterior, and altogether, ethmoid cells they form one common ethmoid labyrinth inside. Yes, ethmoid labyrinth. Inferiorly, there will be one more plate, which is called perpendicular plate. Perpendicular plate is the part of the nasal septum. This forms the nasal septum.
Yes.
And also, there will be two parts of the ethmoid bone, which forms the lateral wall of the nasal cavity, and they are directed to the nasal septum, which are called nasal concha. So totally we have at least three nasal concha, superior, medial, inferior. But inferior nasal concha, they are formed by the separate bone. And superior and medial nasal concha, they are parts of the ethmoid bone. Superior and medial nasal concha. That's all? Medial nasal concha.
Medial and lateral.
Medial nasal concha. Actually, very much the pictures in our Russian atlas. You can use pictures from there, but
Names from translation.
they're nice pictures, and the terms are
Latin and Russian.
written
Latin and
written in
Russian.
Latin. Yes, so and Latin it has not so much difference from English.
Yeah.
So if you want, you can use that. Yeah.
तो पढ़ाई कर ही नहीं सके इतना सही है लेकिन लैंग्वेज नहीं
At that 3D,
अरे बस हो गया ना उसने कहा पढ़ो अभी तुम लोग
Like this. This is Kristagali.
अरे हो गया बच्चे
इसके बाद आया होगा सब
प्यार
फ्राइडे को भी क्लास
Any questions?
क्या क्या हो गया
फ्राइडे को भी क्लास
No. Okay.
Very confused. No questions.
कसम से
No.
हाँ यहाँ पे आना होगा सेकंड 206 में
Okay. If you have no questions, you can take skull bones and look at them. Maybe take photos or something.
Okay. यहाँ पे study कर लेते हैं. Frontal bones थोड़ी सी